Okay, so this is the last lecture for postpartum nursing care, and I'm going to go over the obstetric hemorrhage care summary that is at the University of Utah Hospital. It's an evidence-based protocol, and they use all the guidelines that are set forth by the national agencies. So let's start. So what happens when a patient comes in? They do a pre-admission before she comes in to deliver a baby, and they're going to identify patients that have any sort of special considerations that put them at increased risk for postpartum hemorrhage. We are going to screen all admissions for their hemorrhage risk, and we're going to put them in low, medium, or high risk categories. So right on admission, they are put into their risk category. With a medium risk, with low risk, they're just going to watch what happens, and they're not going to do anything special. With medium risk, they're going to type and screen them just in case they need to order blood products right away. And they're going to kind of, when you do get a patient with a medium risk, you're going to make sure you know exactly what happens with the hemorrhage protocol. So you're going to know exactly what you're going to need if a postpartum hemorrhage does occur. So, but with the high risk, they're going to type and cross-match, and they're actually going to have 2 units of packed red blood cells available for that patient postpartum. They're going to make sure they know the hemorrhage protocol, and they're going to make sure they have IV access with that large lumen catheter so that the blood products can safely go. And then they're going to do an ongoing risk assessment. They're going to see how the labor and delivery goes and see if any of the things that happen in labor and in delivery, if that's going to put them at a higher risk factor because of what happened. So anything like a prolonged second stage of labor, so if she's pushing longer than normally, or if she is put on oxytocin, which is a risk factor for having an atonic uterus afterwards, and if she has any kind of sustained active bleeding, any infection in the amniotic fluid, and then we're just going to, if she has more than one of these risk factors, we're going to automatically put her in the high risk category. So for every birth after the birth, we're going to start oxytocin IV or 10 units IM. We're going to do a vigorous fundal massage for 15 seconds minimum until they get that uterus nicely constricted. And then we're going to qualify all blood loss. So the difference between qualifying and estimating blood loss is they're going to actually measure and weigh everything that has blood in it so that they know the exact amount of blood loss. And then they're going to do vital signs very often to see if there's any tachycardia or problems with blood pressure. So I mentioned before, if there's greater than 500 ml loss for vaginal deliveries or greater than 1,000 ml loss for C-sections, we are going to put them onto stage 1. So this right here, what we're doing here is stage 0. This is what happens for every birth. This is stage 0 of the postpartum hemorrhage protocol. If they have blood loss greater than these two, the 500 and the 1,000, then they're going to move them on to stage 1. If they don't move them on, they're going to do standard postpartum management, do fundal massages, and do fundal checks every 4 hours for that first 24 hours. So if there is increased blood loss, or there is a concern that she's going to keep bleeding because of any sort of trauma or any risk factors that she has, we're going to increase the IV rate of the Pitocin. And there are guidelines that they follow. They're going to follow what is in their protocol specifically. We're not going to learn that here because it's just not necessary. But then if that doesn't work to stop the bleeding, then they're going to go sequentially through the next 3 meds. So Methergin, these are all uterine constrictors. And Methergin, they're going to give if there is no increase in blood pressure because it causes hypertension. Then, if that doesn't stop the bleeding, then they're going to use Hemabate. And this is an IM shot every 15 minutes but this causes risk of bronchial spasms. So we're not going to give this to patients who have asthma. And then the last one we're going to get is Cytotec. And this we cannot give to patients with any cardiovascular, pulmonary, or hepatic disease because it's hard for the body to clear them. And it causes different kind of side effects. So we're going to continue as we're going to do these medications. And then while we're doing these medications, we're going to continue fundal massage. We're going to make sure the bladder is empty and we're going to keep her warm. We're going to make sure her oxygen saturations are above 95%. So we're going to get her on an O2 monitor, SAT monitor at this point, and we're going to keep an ongoing evaluation of her cumulative blood loss because we want to know exactly how much blood she has lost. If she keeps losing blood after 10 minutes or a greater blood loss of 15 milliliters, we're going to put her into stage 2. So for a vaginal birth, we're going to do what's called a bimanual fundal massage. And that means the provider is going to be massaging the uterus from the inside of the uterus. So they're way up in there massaging from the inside while someone else is massaging from the outside. That's what bimanual fundal massage is they're massaging from the inside of the uterus and the outside at the same time to get that uterus constricted. There's some other things we can do. We can do an intrauterine balloon, and I'll show you a picture of that in a minute. It's a Bakri balloon, and that helps to kind of put pressure on the inside of the uterus to cause it to constrict. If we find that there's retained products of conception, that's what this POC here is, retained products of conception, we're going to put her under general surgery, general anesthesia, and do a dilation and curettage. So we're going to dilate the cervix and clear out the endothelial layer of we're going to just remove the products that we can find in there when we do that DNC. And then if there's any sort of laceration or hematoma that's causing the blood loss, we're going to pack those pretty well and we're going to repair them. So if there's a cesarean birth and she has sustained bleeding for over 10 minutes, we're going to continue to a B-Lynch suture or an intrauterine balloon. And I'm going to show you pictures of both of these and possibly ligate that uterine artery. So I'll show you what those mean right now. So this is the inflated Bakri balloon, and it's a fluid-filled balloon, and it puts pressure on the inside of the uterus to get that uterus to constrict. The B-Lynch suture is done under general anesthesia, and they're taking these sutures and basically clamping down manually, so they're artificially manually clamping down the uterus to constrict that huge uterine arteries, those uterine arteries. And then if this still, if they have blood loss of greater than 15 milliliters, and we've given 2 units of packed red blood cells, and they're still hemodynamically unstable, or there is concern for DIC, and they're continuing to bleed, then we're going to put them in stage 3 of the postpartum hemorrhage protocol. So we're going to use some factor R7A, and this is going to help with the clotting. And we're going to get them to the OR because we're either going to do a B-Lynch suture, an intrauterine balloon, or we're going to do an O'Leary, which is ligating that uterine artery. So just completely cut that artery off and stop the bleeding that way. And then if all of those things have happened and she still continues to bleed, then there is almost no other option but to give that woman a hysterectomy. They will try at all costs to not give her a hysterectomy if she wants to try to have more babies, but if her life is in danger, then they will give her hysterectomy. So if she continues with this much postpartum care, they're probably going to put her in the ICU, so she has an increased postpartum surveillance. So she's going to be one-to-one with a nurse at that point. Okay, and that is the end of the postpartum hemorrhage summary, and that is the end of the postpartum lecture.